Okay, we're going to now go over the immunological system medications. As we always have to know is the learning outcomes. You want to define the key terms and then discuss the 5 categories of anti-inflammatory medications when they are used and they have the actions on the body, much like we learned in Module 2. We had to differentiate the difference between the 6 classification and anti-infectives, and with each is used with their actions in the body. Of course, compare the natural and acquired immunity and how they occur. Identify at least 3 different types of the anti-neoplastic medications and describe when each is used and their actions in the body. Discuss the toxic effects, the anti-neoplastic medications on the patients and the healthcare workers, including the proper handling of both medications and the patient's secretions. Of course, the key terms, as I've said before. And then with the immune response, the antigen invades the body and through different surfaces. And orifices, and then the first response of the immune is going to have the bradykinin complement, the histamine and the leukocytins, and the prostaglandins will secrete. The second phase of the immune response is where it launches the attack through the body by secreting antibodies. And they record the attack, which is almost all bacterial, against the future attack. But T cells actually secrete cytokines. But just remember, with viruses, it really doesn't have the exact memory cell as the bacteria infections. Okay, these different medications that affect the immune system, of course, are the anti-inflammatory, anti-infective, antitoxin, antifungal, antiviral, antiparasitic, vaccines, and the antiplastic chemotherapy. So we're going to go in and talk about the autoimmune disorders initially. And those things involve, it's like an umbrella, and this falls under that umbrella, which are rheumatoid arthritis, ulcerative colitis, Crohn's disease, dermatitis type 1, mellitus, multiple sclerosis, peptic ulcers, systemic lupus. Just know with systemic lupus, when they give you prednisone, you want to not stop that abruptly. You have to taper off. Here, with allergies, it could be animal, pollen, mold, mildew, dust, or cigarette smoke. These different people that are sensitive have an overreactive histamine in their body, and will start the protection mode, and those protection modes are sneezing, inflammation, congestion, watery eyes, and may even lead to anaphylactic shock. Some of these are that help block the histamine response, are antihistamines that relax the respiratory, vascular, and GI muscle. And then there's H1 receptors. and then the actual have the Allegra is one of them. And you might have a response with the patient stating that they're actually not itching all the time anymore because it's actually helped block that histamine production. That's why it's called antihistamine. And now Flovent, or you have that actually help treat the allergic reactions. You have Flovent, which is a nasal spray for allergies. Anti-inflammatory medications are continued. You have the thiazine nasal, and there's also the propranololamine. Just remember, a lot of these serious side infections, they give these medications, but they actually can have a rebound effect. So it's real important that to overuse them. Not any more than a few days. Now, anti-inflammatory medications, we went over this before with COX-1, COX-2. Well, I'll just briefly touch the highlights. Ibuprofen, that 800 milligram ibuprofen that they prescribe you after postoperatively, and it's scheduled. It's scheduled because it actually helps with the breakthrough pain and inflammation, two different things. So, it's necessary. Just because they're not having as much pain at the moment and it's scheduled, you give it. And then if you're having any kind of allergies to Motrin, you are going to also have allergies to Toradol because it's the same family. And like, for instance, Celebrex, it's given postoperatively as well, sometimes given instead of Motrin, and it's scheduled. And if they cannot eat, they can't have a swallow study done, and they have thick liquids or actual puree diet, you can actually break that into and open it, this little, and it can be sprinkled into applesauce or whatever their puree diet is, and it helps swallow it. And also it can be used with a G-tube. Okay, I'm going to skip on over here to the anti-infective medications. And we're going to talk about how certain side effects you got to look for some medications. Tetracyclines and monocycline. It's important to know that you need to wear a hat or some sunscreen because you're going to be having more sensitivity to light. Another thing with the tetracycline, they have been overused for ear infections, things like that, years ago, and they found that it actually had the staining on the teeth or the fetus. So you don't give it to children or pregnant women anymore. They learned it after it happened, and I'm from the generation it affected. So now we're going to skip on over to anti-infective medications, and then we're going to go and wrap it up here in a little bit. And I'm going to touch base on the Biaxin. Biaxin is used readily. It's a good drug that actually more broad spectrum, given to older people, but might not have any luck with Ancept, the first line of antibiotics. But it's like if you have a patient in a long-term facility and they're presenting with like a respiratory infection, most likely they're going to be prescribed Biaxin. And same thing, Zithromex is also used very often, especially for sinus infections. Okay, going on over to vaccines. We're going to talk about the, it's a form of a vaccine, kind of like a preventative, since you've been exposed to a medication or something like TB or something that will help prevent those. Um, it's kind of like gamma globulin, but it actually, um, you always want to know vaccines and the methods and administration, but and the batch number and the expiration date has to be documented for consent. But know that, like for instance, let's see, one thing. But anyway, that the TB is like a beta. It's administered IM, and that's where I was getting at on the immunizations. It's actually um, in the category of a vaccine, but it's actually a given to a person once they've been exposed. Other vaccines are all preventative. Some are live viruses and some are not. We'll go into that later. But this is the conclusion of this. I really touched base. Basically, is you're responsible for knowing this material throughout the chapter because I touched on the highlights and you're responsible for the entirety. But I will say that, it's important to know it for the NCLEX and for the ATI exam at the end of the semester. So have a great afternoon. Thank you very much.